Hello, everybody. Welcome to the Therapist Take podcast. We're going to talk about understanding sex addiction, but in particular, the brain's battle for control. So, we're going to be talking about the hijacked brain. So, don't go anywhere. Hi, Carrie.
Hi, Josh.
I know we have a lot to get into today, but I have, I think, a couple of apologies to make to you.
Oh, boy.
Yeah.
Okay.
I waited till now
I'm
to
all
do it. I've been
ears.
holding it in for the last 30 minutes.
Okay.
I did not acknowledge your birthday on Monday.
You're doing it right now.
Yes. So, well, I didn't forget. Because, in our Monday meeting, you
Yeah.
walked in.
Yeah.
I was actually, our office card, I was in the middle of writing on the card. And then you walked in. And so I was like, and of course, I think Hannah said, "Happy birthday, Carrie." And I was like, well, okay, well, what's the point of the card? I'm going to do it right now. But anyways, so that's the first apology.
Oh, okay.
Right.
Okay.
The second apology is yesterday, that card that I slid under my desk to hide from you? I found it.
It was under your desk?
Yesterday. Yes. With all that Hannah's look at her face. And only about half the people had signed it by this point. So I really messed that up on your birthday.
Okay.
So I'm sorry for both of those things.
Okay.
Yeah, but I finished writing on the card.
Oh, I can't wait to read it.
It might not
Will
make...
it come next year?
There was like 3 days in between half of my statement to the next half, so I don't know if it makes complete sense when you read it.
I'll try to keep that in mind.
I think I put ...
Okay, good. 3 days later.
Yeah. Anyways, that's why I called you last night.
Oh, is it?
I was going to apologize last night, but I was like, just wait.
And do it right now.
Yeah, might as well.
Okay.
So I'm sorry.
Thanks.
But happy
Okay.
birthday.
Thank you.
Yeah.
Thank you.
And mine will come next in 6 months.
Well, Rebels is today,
That's right. Rebels is today. Yep.
so.
All right. Well, we should dive into this.
Yes, we should.
Okay, so before we get started, we're going to do our typical housekeeping things. Just remind everybody to subscribe to our channel if you're on YouTube. I'm going to go a step further and ask people to like the video if you like it. Maybe we can get more momentum going with views on that. But also, if you're listening to this on the audio platforms, please give us a 5-star review. And if you want to go the extra mile and write something nice, that'd be great. And I think that's probably about it, I guess.
Okay. All picked up.
Well, you're right. Something I left out, you can go back and watch another video where I said all the other stuff and do the same thing.
That's
every
right.
video. So, okay, well, let's go over just the episode breakdown before we jump into the actual items. So we're going to start by talking about dopamine and the neuroscience of sex addiction. So we're talking about this idea of the hijacked brain. And so, with sex addiction falling under the category process addictions, I'm sure that'll probably come up. There's this concept that we call the hijacked brain, and it has everything to do with dopamine. So we'll talk about that. Then we'll move into talking about maladaptive coping and the role of trauma. And then neuroplasticity, which is a fun word to say, and the challenges of breaking free of the addiction cycle. And then we'll kind of finish up with talking about finding hope in recovery. So that's what we're going to do, or we're going to attempt to anyways. Yeah.
Yeah, got it.
So this is you and I both have a love for neuroscience, right? And brain stuff. I read so many things. I don't know how much I'm going to be able to accurately recall,
Right.
but the complexities of the brain is fascinating, and I think maybe somewhat scary. That's why I think it's so fascinating.
Yeah.
I don't know.
Yeah.
You feel the same way?
Yeah, I think it feels, I'll never completely understand it, which makes me still want to pursue understanding it. Yeah.
It's like, ooh, something we can't accomplish. Let's go.
Right, let's do it.
Something we can't finish. Oh yeah, that's right up my alley.
Yeah. But I think I like it too, because a lot of times when I read, some new information, I'm like, well, yeah, that seems kind of intuitive, right? That makes some sense when you think about being a mental health practitioner.
Right.
You know,
Yeah.
that we didn't know that's how therapy was helping.
Yeah.
But now we have, the biological description of how therapy is helping.
Right. Yeah. And it's like, it seems like anything related to human beings or biology, maybe because it's constantly evolving, or probably a combination of it constantly evolving and the science is getting better. So we're figuring out where we went
Yes.
wrong and
Right.
things like that. And
Right.
sometimes things come full circle. It's kind of like, remember when they're like, if you get bit by a snake, the old snake bite kits had like a little razor in there that you have to
Yes.
open up the wound,
Right.
suck out the venom.
Right.
But
Yeah.
they're like, now they're like, the worst thing you could do is actually cut yourself
Right.
while,
After
you've been
bit.
bitten by a
Yeah.
snake, because you increase the chances of infection.
Mm-hmm.
And the chances of you sucking out any venom is slim to none. And so it's just interesting how it's like,
The more we know, things
yeah.
change.
But then we have like the whole things like, do you put babies on their back or on their bellies, or on, it's just like, what do we do here? But I think it's similar to some of the things on what's effective in addiction recovery.
Yes.
And these things are constantly under debate.
Yes.
The literature is constantly being reviewed and picked apart, and we're left to just kind of go with what we have. So
Yeah. Yeah. But we are always trying to evaluate it.
Right.
That's part of the reason we're talking about it today.
yeah. So sex addiction. You and I are both certified in sex addiction treatment, helping people recover from this concept of sex addiction, which we try to be careful to distinguish from sexually compulsive behavior,
Right.
which is part of sex addiction. But
Right.
not everybody that is sexually compulsive are sex addicts.
Right.
But all sex addicts are sexually compulsive.
Right.
Right. And so that's something that, we as practitioners, we have to be careful to not jump the gun into just
Right.
labeling everybody who battles some kind of sexually compulsive behavior as an addiction.
Absolutely.
Right?
It's very important.
Right.
Yes.
So to kind of flow with the podcast here, what would you say for you in particular as a provider of this, what are you looking for that really sets that apart for you?
That sets compulsive behavior apart from addiction.
Yes.
I think of it more of on this kind of, I think you're alluding to this kind of a continuum.
Mm-hmm.
Right. So sexually compulsive behavior, especially people that come into therapy, are having some kind of problem. Right?
Right.
When you're thinking about addiction, you're going to have more problems, right? You're going to have more severe problems. So you're going to have more of a disruption in what's the language in the diagnostic manual is severe social, occupational, and daily disruption of functioning.
I can't believe you.
Right?
I can't believe you know that like by heart like
Yeah,
that.
well, that's easy.
Word
peasy.
for word.
That's easy peasy.
Yeah.
So you're going to see that it's harder. You're going to see often, especially when we're talking about it, starting to shift from behavior that's compulsive. Compulsive meaning that it's something that you're driven to do even though you know it's not good for you, right? Addiction also is where you're going to see things like tolerance. You're going to see things like increasing the behavior in an attempt to get out of it what you used to get out. You're also going to see people that have tried to stop and been unsuccessful, right? And the patterns seem to escalate. So those are often the things that you're going to see that's going
Right.
to help you as a diagnostician and a treating provider to kind of understand what level of intervention do we need here,
Right.
right?
Right. And there's been controversy over the years on
Yes.
is it or is it not. I thought about spending a lot of time talking about that in particular, but since we're going to be talking about dopamine and the hijacked brain, we're just going to operate from the assumption that if you're watching this, then you lean toward their
Openness of this.
right, that sex addiction is actually a thing. Now it's not in the DSM, but it did make it into the ICD-10 or ICD-11, which is those are diagnostic manuals that we have, what we use to diagnose, what insurance companies require
Yes.
for a lot of treatment, and I've heard that there are political reasons on why it didn't, make or on why certain things get in or why certain things don't. I don't know about all that. I can completely understand with all the controversy around it and the debate, maybe why it's taken so long. But I kind of wonder sometimes if part of the reason, and when I say it's in there now, it's in there as a compulsive disorder. It's not in there as a dependent dependency, which is
Right.
what we often refer to as addiction.
Right.
So it's, I think it's just sexually compulsive sexual behavior. Yeah,
Problematic
you're right.
sexual behavior. Right.
Yeah, something like
And
that.
the ICD-11, I believe that's.
Right. So it's not even listed.
Compulsive, I don't believe is in the correct title.
Right. Well, if, whether or not it is, it's still not listed in the category of a dependency.
In the category
right?
of the, right, where you look up disorders, yes.
Yeah. And so I'm wondering if some of the reason why it has taken so long is because it's a process addiction, and I know there are some in there, like gambling made it in, and so I think it's important to understand the difference in a process addiction and a chemical addiction,
Yes.
and there are certain the complexities that go along with process addictions. Addicted to a process, addicted to
Right.
something that is central to your processes as a human being. Getting addicted to food, for example, food
Right.
addicts. Video games, like. Those are a couple things that people have bought into. Gambling, most people say
Yes.
you become a gambling addict.
Right.
I think what's hard about sex is that, we do want to be careful of not being sex positive,
Yes.
which a lot of people think sex addiction therapists aren't, which we are. We're very sex positive, or we
Sure.
should be.
Right.
But this kind of contrast of like. Sex has become this thing that has been highly disruptive, and it's kind of correlated with something like drugs and alcohol that you get addicted
Right.
to.
Right. Right.
So it's bad.
Right.
How can it be good? And it's more like a coexistence of
Exactly.
of things.
Both.
Right.
Yeah. I just think it's hard it's easy to see that there is this substance. And when I ingest this substance, my state changes. And
Yeah.
I can say, this thing I ingest changes me chemically. It's harder, I think, just intuitively almost to think an experience, a process changes my state, and then I become addicted to that. That's just harder, I
Right.
think. And that's part of the reason we're talking about this today is that there are biological things happening,
Right.
during these processes. And so while, yes, ingesting alcohol or a drug is changing you because you're putting chemicals in your body, we're also going to talk about a little bit about what is changing in the brain, right?
100%.
For people when they're engaged in these
Right.
problematic processes.
Yes, and there's been a lot of research done on this, and I didn't put any research articles in the description of the video. I did, however, put a lot of different books that talk about the hijacked brain and reference a lot of research that's been done. Those you can find in the description of the video, or if you're listening to this on the podcast, you can check your show notes, and you can kind of read some of these books that people have talked about this and compiled the research. One that I didn't list was actually Alexandra Katahakis's book on sex addiction and affect dysregulation. I'm actually we quote it in here. I did for some reason didn't link it in there. I think maybe it's a very thick.
It's a very high
technical
level book.
book, yeah.
It's amazing. The quality of work
Right.
is
It
excellent.
would be a good textbook for a college
It was
course.
exactly a graduate textbook to
Yeah.
me. Yeah.
No question about it. Yeah.
Yeah.
So let's start talking about so the first point is dopamine and the neuroscience of sex addiction. We're talking about how the brain's reward system gets hijacked. So we often, when I think of the thing that's determinant for me, is I am looking for the hijacked brain in addition to the things that you talked about. If someone were to ask me to describe what does a hijacked brain look like if I'm a fly on the wall seeing somebody get a hijacked brain. I've actually shown some video clips from this before. I'm not going to do that right here, but there's some movies out there that did a really good job of portraying this. But to me, it's the person who's driving down the road for their next hookup, and the whole time they're driving, they're saying, "I don't want to do this. I don't want to do this." And if you're the fly on the wall watching this, you're like, "Why don't they just turn the car around? It's just turn the
They
car
just
around,
don't.
shut the laptop lid,
Right.
things like that." But they just can't bring themselves to do it. They are going to go do it, even though they don't want to.
Yeah.
And there's a quote from the book Screw Tape Letters where C.S. Lewis wrote, where I'll I'm not going to go into the context of what the book is about, but the way he describes basically a full-grown addiction is from a kind of a spiritual context is to get the man's soul and give nothing in return. That is the formula. So a full-grown addiction, like a lot of addicts that we've worked with, like they really aren't getting a lot out of this.
Yeah,
Like,
yeah.
they don't necessarily feel better as much as that at most they just feel nothing or a lesser version of pain,
Yeah.
like a subsiding of pain, so to speak, but at some point it doesn't even make them feel good
Right.
like it did in the beginning.
Right, right.
So that's kind of when we talk about hijacked brain, and that's what we're talking about, and that has everything to do with dopamine.
Yeah, yeah.
So I'm going to read this quote
Yeah, I was
from
gonna say, yeah, let's
from
do it.
Alexandra in her book that we just mentioned, and then she paints a really good metaphor, uses a metaphor to describe what's happening in the brain, and I've had to cut it down a little bit just so I could fit it all on screen. We actually are doing it in 2 different slides here, and then Carrie and I are going to talk a little bit about this metaphor. So she says, with unrelenting waves of dopamine smashing up against its hull, the DACC, which is the captain of self-monitoring and resolving conflicting goals, such as an extramarital fling or versus fidelity, can barely stay afloat. It fights to ignore the destructive dopamine-laden sexual impulse over and over again, the one that says, do it. But eventually, the DACC depletes its supply of energy, glutamate and GABA, both sources of glucose and the neurotransmitters that carry messages between neurons. Battle worn, it capitulates, and the DACC is now hostage of the hijacked brain. And as we discussed before this, the DACC is the dorsal anterior cingulate cortex.
You did it. Good job.
Yeah.
We're right along there. Right.
Dorsal anterior cingulate cortex. It's part of the brain.
Yeah.
It's part of the ACC, actually. It's a different kind of housed within the ACC, which is the
So dorsal
anterior.
means left, right? So,
Yeah.
yeah.
So, okay, so when you hear that metaphor, like
Yeah.
every time I read this, I have to spend a little time picturing the captain of the ship, the waves, trying to capture, what is happening in the brain with this metaphor. It's a pretty good metaphor.
It's a good metaphor, yeah.
How do you understand it when you?
Yeah, that there are parts of us that are trying to battle this, right? But like in your description a minute ago, when the person is driving to their next hookup, right? There's this I don't want to do this is probably some messages from the captain of like, this isn't good, this isn't going to take us where we want, right? But it gets overwhelmed, right? And
Right.
it just keeps driving. It
Right.
just keeps staying on the course of, destruction at that point.
Right. Yeah, and this captain is responsible for some level of self-awareness,
Yes.
but then and then decision making. Particularly, deciding the decision being, do I do this or do that?
Right.
This conflict of these two things.
Right, the self-monitoring of that.
Right.
Yeah.
And if, extramarital affair or fidelity, unfaithfulness or faithfulness.
Right.
And as dopamine, being these waves, keeps hitting up against the hull, a good amount of energy is being used just trying to keep that at bay, which reminds me of white knuckling, which comes from the squeezing your fist, right? And your knuckles turn white.
Right.
Right. It kind of reflects someone just trying to power through something.
Power
And
through.
we often talk to addicts about you might find some success in that at times, but eventually it'll let you down.
Yeah.
And so, as that dopamine just keeps pounding and pounding and pounding, eventually it's too much.
Yeah.
And being drained of energy, the captain gives in, basically.
Yeah.
And so now who's steering the ship? It's kind of like the waves are, in a sense.
Right.
Like
The ocean. Yeah.
Right, exactly.
Yeah.
Like it's not even a rudderless ship; it's a
No.
captainless ship, right? And so that's when we kind of say, like, once the brain's been hijacked, it doesn't matter what you want anymore. If you think of yourself as the captain, it doesn't matter what you want anymore. Your brain's going to do what it wants now, being the ocean.
Right. Right.
So like I said, I found that to be a very
Yeah.
helpful metaphor.
Yeah, and I think it's helpful too for people to know that there's this biological explanation and description, and you can see the processes and mechanisms, right?
Yeah.
That's happening for people when we hear it told, right? Or maybe you've experienced yourself in your own body, or you've said it to your partner, or you've heard it from your partner. I was trying, I was white knuckling, I was telling myself it's not what I want, but I did it anyways. I don't understand.
Right.
That's what we hear, and now we
Yeah.
can see what's happening
Right.
on this really cellular level.
So let's look at it like using the example I gave of like someone's driving down to the car to the next hookup. How is dopamine hitting up against the hull there? Because this person hasn't technically acted out yet. I mean,
Yeah,
they're
right.
in violating boundaries like crazy, and they're on their way to act out, but they could still turn the car around.
Sure.
There's still hope, right?
Sure.
Well, I mean, they're getting a dopamine hit.
They're already, I think some of the data shows that actually the highest amount of dopamine release is not during the acting out, it's on its way to the acting out, right? So you've already surrendered before you've ever actually started any kind of sexual encounter.
Right. Beginning with probably things like euphoric recall, which
Exactly,
is
right.
when their brain starts imagining the whole charade.
How you will feel.
Right.
Right.
And then to things like, pursuing it, driving to it, the battle is generating that dopamine, as you
Right.
said, in large amounts of it. Now there is dopamine that gets released in orgasm, but actually the main chemical released at orgasm is oxytocin and some vasopressin, I think, which is your attachment hormones.
Right.
And so I was reading up on this, and what I found to be interesting is that we're going to talk about maladaptive coping here in a minute, so it's it's one of those things, right? It's hard not to go into the next thing, but where at orgasm, it shuts off your dopamine receptors, like it shuts dopamine down. So if you really think about it, like this, it's this build up. You think about the mixture of feelings in terms of excitement, eroticism, shame, and the heightened nervous system. And then at orgasm, I don't feel any of it anymore.
Shut off.
So sometimes not feeling anything feels really good.
For just a brief minute.
Right, for some people, right?
Oh,
And
yeah.
that's why
Well,
it's so
for all
enticing,
people.
right?
For all people.
Yeah.
I mean, anyone who likes to get on their phone and scroll,
Oh my gosh, yeah.
you like feeling nothing.
Right.
Right.
Yeah. And so, as the brain is unleashing all this dopamine, the brain has to also regulate it.
Yes.
So it's called down regulation, right? Where the brain actually, you think it would pull back the dopamine, but it actually minimizes its dopamine receptors. So it starts pulling the dopamine receptors away. I guess, I don't know if it just gets absorbed in the synaptic cleft, after the dopamine fires. Dopamine's a neurotransmitter, correct? Right? So when it fires into the space in between two neurons where the other neuron's going to basically suck it into itself, right? So there's reuptake, right? So it's either going to get caught in the reuptake, or it's going to just absorb and lost in the synaptic cleft, is what they call it.
The space between.
Right, the space between. So, so when someone is getting excessive amounts of dopamine through the sexual behavior, the brain downregulates, right? And so now things that is supposed to bring you joy through in pleasure from dopamine, you're not getting as much, right? So how many people we worked with were like, it's like the only fun thing and it's even not that fun
Now
anymore.
it's not even that fun. Yeah.
Right? It's like there's so, and because the brain is really doing what it's supposed to be
Homeostasis,
doing
right.
in this,
And
right?
it's
You
the-
know, and so,
Right.
but I think it's really important that people understand that this is a brain problem, not a heart problem.
Right.
I mean, it's something we talk about
All the
quite
time.
a bit.
Right.
How do you talk to people about that usually?
Yeah. The good news, Josh, I will say, is I don't have to spend as much time almost convincing or sharing this with people. I feel like from when we started practicing to when we practice now, there's much more acceptance, I think, in general, about
Yeah.
addiction and about neuroscience has a kind of, become almost a consumption by the public, which I think is wonderful. So I don't find that I have to do it as often as I used to, which is, I think, a good thing. But I definitely will say this is not about character, right? This is not
Right.
about willpower. This is not about love, right?
Right.
This
Ooh,
is,
that's hard.
I know. It is hard. But to understand, if you really want to understand addiction, then you have to be able to actually look at the information,
Right.
right? And so, yeah, and it's really hard to hear that as a partner who's been
Oh,
betrayed
man.
by,
Yeah.
if you're in a relationship with somebody struggling with sex addiction. It's like, well, maybe
Right.
maybe that's true, but it sure
Yeah.
doesn't feel like that, and that is true too,
Right.
right? But I really I've always liked the way you've said it, that this is not a heart problem.
And that's important for me to let the addicts know. And
Yeah.
as we've talked about before, when it comes to our practice, 90% of the time I'm the one working with the addict
Right.
and you're working with the partner. And the addict needs somebody to show them some compassion,
Absolutely.
and to remind them that they're not a bad person. It's not really the partner's job to do that. They need to be mad. And they
Yeah.
need, if you're a partner listening to this, if you need it to be about those things right now because you're angry,
Yeah.
last thing we want to do is rob you of your experience with anger
Right.
by trying to water it down with science. And
Right.
we do want to present reality, but
Right.
there are ways that we can do that without
That recognize what
being
healing,
offensive.
right,
Yeah.
and that's not the healing path for them. right?
Absolutely, 100%.
That's
Right.
not. So this information that we're sharing is good knowledge, but I
Mm-hmm.
do think it's fair for us just to kind of talk about, because we're treatment providers, we're
Right.
thinking about meeting people where they're at, right? So I
Okay.
feel like we're talking about right now, like, hey, this is important to know, but if
Right.
it's not where you're at, then it's not where you're at.
Right. So let's talk about this, this behavioral aspect
Yes, yes.
of it. This is behavioral, so this is the behavioral aspect of addiction or also sexually compulsive behavior.
Yes.
Is this idea of maladaptively coping, and then we want to talk about that specifically with the role that trauma plays. So, how do you see it in terms of what people are doing when they're quote unquote maladaptively
Maladaptive, right.
coping? Yeah.
I think just in general, kind of wide lenses, when you hear maladaptive coping, I think people understand that they're doing something that doesn't actually help the problem, right? So it's not actually addressing the issue, right?
Right.
So if I have a paper due and I stay up all night on Netflix, I can say I was stressed about the paper, but my coping with my stress by ignoring it, by, loading up on screens was maladaptive.
Right.
And I think all of us can identify some of that, right?
Right. Yeah.
I think that when we're talking about something like sexually compulsive behavior, all the way to an addictive pattern related to sex, it becomes really important to try and understand that this isn't an eraser that every negative feeling, thought I have, I cope sexually.
Right.
But what are what are you trying to cope with
Right.
through your sexual experience?
Right. So trauma. Would you agree that trauma's kind of fueling that?
Absolutely.
Okay. So how does it fuel it?
Shame, I think, is at the core, right? But
Yeah.
I'll just point out a number that, to me, is stunning in the world of mental health, because, we don't have numbers this strong very often, right? But 97%, am I correct, Josh? 97% of people who actually meet, diagnostic criteria, if there was diagnostic criteria, for sexually compulsive behavior and or sex addiction have some kind of, at minimum, neglect in their childhood.
Right.
Most likely some kind of abuse and urgent
Yeah, I think the
right?
97% is emotional abuse.
Emotional abuse all the way
Yeah.
up to,
Yeah.
what we would think of as physical or sexual
Right.
abuse, right?
Yeah.
So that number to me tells
Mhm.
you how much
Right.
that this is about early life experiences that were harmful,
Yeah.
right? Traumatic.
Yeah, and that was research done by Patrick Carnes and his group at ITAP. Also, too, just to kind of clarify for people, like when Carrie says if there was a diagnostic criteria, there is one. It's just not in the DSM,
Not in the DSM, right?
or in the ICD-11. But Patrick Carnes, who's widely considered the grandfather of sex addiction treatment, his team has put together a criterion that's used by practitioners all over the country, all over the world, to help identify this.
Yes.
So yes, yeah, you're right, and yeah, so I think you're right. Like it's about 97% with emotional abuse and neglect, and then it drops a little bit when it goes to physical and to
Right.
sexual.
Right.
But yeah, it's an astronomically high number.
Astronomically
Yeah.
high. Like I said, we just never see anything like that really in mental health,
Right.
right?
Yeah, so it definitely fuels it, but like so I'm gonna have Hannah put up this quote. You know how I am. I like to kind of come up with these clever quotes, and it really helps me. I know sometimes it might feel like I'm just trying to be cute with these quotes,
I don't
but
think
it
so.
really helps me be able to paint a better picture for my clients. That's
Right.
why I actually do this.
Right.
And so I'll think of like stumble over my words and some kind of monologue trying to get to a point, and when I get there, I'm like, I'm writing that down because I can just say this.
And that summarizes it
And
better.
that
It's like a
summarizes it.
mantra, right?
Yeah,
They
right.
encapsulate something.
Right. So the one that I'm going to have put on the screen here, something I say to a lot of my clients, and that's when you choose to cope with your darkness in darkness, you're bound to do dark things to cope with it. So I'm constantly thinking in images. I think that's why I like the metaphor of the captain of the ship. And so when I'm thinking with what's happening, especially in a couple relationship, or somebody's maladaptively coping, is I can bring my darkness or what I'm struggling with to the light, which is like where relationships are, where your group is, or I can hide it, so I can go away from it into the darkness. And when you go into the darkness to cope, the only things available are dark options, and it doesn't mean you can't maladaptively cope in the light. I just think you're less likely to.
Yeah, and to the extent.
Right. And so,
Right.
and it's not what people need to, what I try to be clear on with people is that they're not maladaptively coping with the reality that I am a sexually compulsive person. Now, that is part of it, but that's not where it began. Like
Right.
basically that was the mechanism to help them cope, which ultimately became part of the secret, and now I'm also having to cope with my coping mechanism, meta coping.
Meta-coping.
We talked about, we love meta stuff.
We've been doing that all week.
Right. So, but the darkness, the original darkness, are things like I hurt
Right.
and I suffer and I'm stressed and I feel things and I have a dark history. I have bad things happen to me.
Right.
But sometimes it's just I don't believe the same thing you believe or feel the same way you feel, or sometimes you hurt me and I don't tell you about it. Like I just haven't found my voice in that way because for some reason my brain thinks it's not good to express that way, to speak up in that way. And so so what that means is that if I do that, then you might not like that. That's going to create conflict and
Right.
chaos. And if my jobs, I think this is particularly true for men. I'm not saying women don't deal with this any, but I think historically this is true for men, where they feel like their job is to be providers and protectors and to basically keep chaos, to minimize chaos from
Right.
their environment, create order. And so emotions, this is an emotional thing that happens. That darkness is an emotional thing. And if I bring that to the table, I'm introducing chaos into the system, is how it feels. And so why would I want to do that? I need to
Keep it out.
I need to just I call them professional shit eaters.
Mm-hmm.
You know, like I'm just good at eating it. And I know a lot of partners hearing this probably feeling the same way, that they've been eating a lot of it,
Yeah.
and that's true.
Yes.
But I'm not. I'm talking about, let's go back in history even
When it
before
began.
the
That's right.
partners,
Right.
and look at to see, you know, how much chaos this person has had to absorb
Yes.
because it was not safe for them to do otherwise.
Right.
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 Whether it's emotional, physical, or
Right.
physical. Right.
Right. Sure.
And so that's the making of a sex addict right there, or an addict.
Addict.
And
Right.
it just so happens that some people, you know, I always tell people, like, you know, that day that you found your grandpa's porn magazines, you know, if you had found his weed stash, you might be here for a completely different reason.
You don't know.
You know,
Yeah.
because, you know, whatever it was that helped you get through that day or that moment, it probably did help at that time.
Sure,
But
yeah.
it's maladaptive now.
Yes.
So
Yes.
that was a long-winded response,
Maladaptive coping.
Carrie.
Well, you summarized it.
Okay, I was just
Sure,
saying
yeah.
that I can go on monologues.
Well, I think that the point of this is that the treatment becomes understanding where this began.
Right.
And I do think that that's something that partners, you know, especially the partners that are getting support that they need, can go, okay, like, this didn't start with me. Like, this isn't, you can't cope with me. I'm too much.
Right.
I'm problematic, and you had to go do your dark things because of me.
Right.
It's really the idea about the person that is struggling with the addiction is beginning to take ownership not only of what they've done, but where did this
Right.
start? And you really need an origin story, right?
Yeah.
Good recovery requires
The
an
origin story is so important.
Yes.
Yeah. And people just don't want to go there,
Yeah.
which I understand.
Sure,
Like,
sure.
it's really dark.
It's hard work.
And how many times have we met together and we're having to process something we just heard?
Yes.
You know, because sometimes we're the only ones
That I've heard.
that hear those stories in their lives. And I consider that a privilege
Oh,
and an honor to be that
absolutely.
person for people.
yes.
But at the same time, this is why therapists need therapists,
Yes.
right? Because it's amazing what people are going through, and they're up walking around.
Living life, going
Like,
to work,
what in
taking
the
care of
world?
people.
I can't, it's like,
I know.
it's almost surreal.
It is.
Like, because I'm like, I think, like, if I went through that, I don't know.
Right. I'd be in a fetal position.
I would be, yeah, you'd have to put me in a straitjacket or something,
Yeah,
and just
I
lock
don't
me
know.
away,
Yeah.
or because I don't know if my brain could handle it. It's
I
what it
know.
feels like
That's
sometimes. But
right.
I think everybody has. Even how many times have those exact same people reflected on something somebody else was going through, and by comparison, it's not even close. But they're like, man, I don't know if I can handle that.
Sure.
You know what I mean?
I
So
know.
we all have that, but it's just, it does speak to the resiliency of the brain and of human beings. And
Yes,
so
it does. Yeah.
we're just so anybody listening to this, we're quite impressed with our clients. To be, aren't you?
Oh,
Like,
yes.
like,
absolutely.
yeah.
Absolutely. Well, you always say it. They're the best people.
They are
ones who walk through our
the
doors are
best
the best
people,
people.
the strongest.
Yeah.
You know, we talk about partners are some of the strongest people we've ever worked
Yeah.
with.
Mm-hmm.
I know that, you know, it's kind of hard for people who don't understand the world that we operate in as clinicians, might have a hard time understanding what I'm about to say, but these addicts and sexually compulsive people are some of the most compassionate, loving creatures that exist on this planet. And that's part of why it's so hard for them to manage, because a lot of them are what I call empaths, and which means like it's different from being empathetic. And you have more agency when you're empathetic. Like I can
Yeah.
choose to be empathetic
Right.
and then go back to my life. But empaths, they just feel the pain of the world all the time, you know.
Yeah.
And
And that's sometimes none of us can do that, right? We all have to turn it off.
right, it's hard. Right, you have to
Yeah.
learn to regulate it. I think it's. I've said this before. You know this because I've written about it. About that. I think it's the closest thing. Being an empath is the closest thing we have to a superpower as a human being. But if the only way you can use it that way is if you have learned to regulate
Yeah.
it, right?
Yeah.
I mean, just think of it. The person that can walk into a room, and I think Mr. Rogers was like this. That's who I wrote about. You know, he could walk into a room. This is how he was described, and he walk into a room and just know who was suffering. You know, he just had that ability. You know, and so
Sounds good, but it's hard to do.
very,
hard
very
to
difficult.
do.
Well, that gets into our next part
Yeah, I was
here.
gonna say, let's go into that. Yep.
The third point is just talking about the challenges of breaking the cycle, and particularly how that relates to neuroplasticity, which I don't know why I
You
love
like
saying
saying
that
that
word.
word. Some words are just fun to say.
It is fun to
Yeah.
say. It just feels good coming off the mouth. The mouth. Okay, so yeah, neuroplasticity. Can you define that off the top of your
It's
head?
the way
Just-
that the brain
right.
is plastic, meaning it can shift and change and adjust,
Right.
right?
Yeah, which is a good thing.
Is
Like
it
the ability for the
right.
brain to change, to create new neural pathways.
Right.
You know,
Right.
is
Yeah.
what. And this, I do think Norman Doidge, who I have a book here. If we could put that book on screen, it's called "The Power of the Brain."
Uh-oh.
What's it called, Hannah? The brain that
That
changes
changes
itself.
itself. There
I
it
can't-
is.
of course, I have to remember it, but by Dr. Norman Doidge. Fascinating book. Have you read this
haven't read
one?
that one.
It is, and Carrie, you're gonna love it.
I know.
It is so good.
Good.
I think this one was even written like 2002 or something. I was actually visiting Alexandra Katahakis and I saw it on her bookshelf and I'm like, of course, because I'm a brain junkie, I'm like, well, I'm gonna read that. So I just, put it in my phone and then bought it and I was like, this is so good. But I think I didn't know this at the time. I think he's the one that coined the term neuroplasticity
Oh,
or
cool.
discovered the
Okay.
concept of it. And I also didn't realize that that seems not very long ago to me.
I know, but
But I think it tracks, though.
yeah.
Like,
Yeah. Yeah.
I don't remember hearing it before.
I think it's important. My joke with clients is like, it means that you can change, which if you're older than 25, thank goodness, right?
great.
Because we want to be able to change, right?
Yeah.
Change our mind, change our thoughts, change our
Yeah.
patterns, change our perspectives. Yeah.
Yeah, then there's some good things. I mean, there is some truth, behind, the idea of you can't teach an old dog new tricks. That what's not true about that is that it's just not true. You can teach an old dog new tricks, but it does get harder to teach old dogs new tricks
Yes.
because I can't remember what chemical it is that gets released in our brain that allows for neuroplasticity to happens mostly when we're younger.
Right. It's changing all the time.
Right, in our brains, especially when we're really young, and our brains completely
Yeah,
developing. This is
right.
why I think in the book that I've linked called "Wired for Intimacy," which is by
Tatkin.
Dr. Struthers. On
Oh, so,
yeah, it's the one that's it's called "Wired for Intimacy: How Pornography Has Hijacked the Male Brain."
okay, there's another
And-
wired one. Okay.
And he talks about like in adolescence why it's really important for to keep them away from pornography because their brains are going through this change,
explosion of
right?
change, yeah.
Huge.
I think it's the first 3 years and then adolescence, right? The two most
You're right.
times of brain change, right?
Yeah, and so he said it's so much that it can that just the observance of pornography itself can be traumatic. So if for some people that might be a porn addict, might be one like I can't think of any, significant trauma, any emotional abuse or neglect, and like sometimes, according to what he is saying, is that it's the observance of it and that rush of dopamine hitting your brain like it does and your brain being so formidable is the trauma.
Wired and fired.
So I think
Fired and wired.
right, they talked about that in some of our training of like when we were kids, because of the way technology was, chances are if we stumbled onto pornography it was probably going to be in a magazine
Right, photographs.
or
still
something like that,
images,
still image of someone who was nude, right? Not even performing a
Right,
sex act,
sure.
right? Nowadays, when kids stumble onto it, it's going to chances are it's going to be hardcore pornography,
Sure.
and so you can imagine like going from somebody, when I think the average age is like 9 or 10 or 11, something like that. And so someone who likely doesn't even have a conceptualization of what sex is,
Right.
and then hit with that,
Yeah.
you
Yeah,
know,
right.
that's powerful,
Yeah.
right, on the brain. So, but the good thing is from birth to death, there is neuroplasticity exists, and so we have to. That's part of what treatment is
That's what
about, is
therapy
working
is,
toward
yeah.
that, right? Is
Sure.
helping people, helping the brain change itself,
That's right.
allowing it to go forward. Someday we're going to have to do a podcast, get somebody in here and talk about psychedelic assisted trauma treatment, because when we were talking to Jennifer Morris about that, Dr. Morris, I was glued to her when she was talking about this how
Yeah.
it works with neuroplasticity.
Yeah.
So someday we'll have to do that.
Yeah. Sounds good. All right. Well, you wanted to talk about white knuckling, right?
Yeah, I mean, I
We
just
mentioned
think,
it a little bit.
yeah, I think it's important as part of, in breaking the cycle of addiction, what people often do is they will just try to do this on their own.
Yes.
And move and try to push forward. That's where this whole idea of like just white knuckle it, like just hunker down, dig your
Yeah.
heels in,
Right.
and just power through, and as much as that is great for some things in life, and it's just not how it works with this. Like, I don't know anybody that's been able to really do it on their own. Like, community seems to be astronomically huge in
Important,
this
Yeah.
in recovery process.
I agree.
You can go to, I mean, I think it's more important than therapy,
I think that's
because
probably
therapy
true.
is not going to be effective if you don't have
Anybody,
community,
anything,
right?
yeah.
And so we find ourselves a lot of times working with people and like, hey, who are your people?
Right. We say that often.
Yeah.
Yeah.
Who are your people going to be? Because you kind of need to rally the troops sometimes and
Build your troops.
And what's interesting to me, does this ever happen to you? They'll write down their people. I want to know their names. I want to know who they are, what their role is. Are they sponsors, mentors? Whatever. Okay, so here they are. Okay, so have you told them they're your people? No, not yet. Because what addiction is about, when we're talking about maladaptive coping, it's an attachment disorder.
Right. Right.
So, the addicts don't know who they have people that are in their lives, but when it talks about sharing something as intimate as this and going through something hard, like they really don't have people in the beginning, so we have to help them get people, and that's
right.
where like the 12-step groups come
Right,
in,
right.
and AA, SA for sex addiction, SAA, Celebrate Recovery, things like that.
S&On. Yep.
It's just a good place to start, but there's actually a lot of
Great.
other types of communities too.
Yes. Yes.
So, anything that would be important with white knuckling that we should mention?
No, I think we've talked. I mean,
Okay.
you can. The good news is there's more available. You don't have
Right.
to choose that as your method.
Yeah, right. The other thing I think is important too, where people are trying to do this on their own, is we see the co-occurring compulsive behaviors, and so how many times does somebody walk in and they're like, I've been sober from alcohol for 15 years, like, oh, congratulations, this is a
That's
great
great.
accomplishment for sure. How long have you been acting out with prostitutes? 15 years. Like may have seen a little bit of a trade-off
Maybe
there,
we traded one for
and of
another,
course the
sure.
brain is, sneaky. The addict is, because, it went from a chemical dependency to a process addiction. And so, actually, my uncle, who's still alive, I love him to death, but I will never forget when he was trying to quit smoking by dipping,
Oh yeah. Sure.
which I think probably happens a lot of people, because
Sure. Still want the substance, but I'll try to change the
Right.
delivery method. Yeah.
which I haven't seen him in a very long time, and so I don't know. He may have accomplished his nicotine
goal.
addiction, but at one point in time, he was smoking and dipping.
Yeah.
So it didn't really have
Yeah.
the effect.
Yeah.
But yeah, I mean that's using another compulsive maladaptive behavior to replace the other. It happens a lot.
Yeah.
So,
Food. You
right.
stop,
It's very
eat
rare
more.
to just see one thing.
Yeah, I mean, we see substances with sexually compulsive behavior a lot. We see work, compulsive work
Mm-hmm.
paired a lot with sexually compulsive behavior,
Mm-hmm.
right? Yeah.
Right. So we've established, what we're talking about when it comes to dopamine and the hijacked brain. We talked about it in terms of maladaptively coping and kind of teetering into the hope that comes with neuroplasticity.
Yep.
And now, when it comes to now, what do we bring
Recovery.
all this together?
Yeah.
And
There we go.
when we're talking about people finding hope in recovery, what are we talking about?
Yeah. Well, we're talking about work.
A lot of work. Yeah.
Yeah. No, but you and I talk about the way we describe the work that we do, that where the hope is in recovery is we've identified what we call the pillars, right?
Right.
So we've organized it in that way because when we really look across the literature and across disciplines about really how do people recover, right? How do people not only get sobriety, which means abstaining from the process or, taking of the substance that's been harmful, detrimental, but actually recover, meaning heal, right?
Right.
Which would mean that you actually heal some of those attachment injuries when we're talking about sex addiction, right? It is not done in isolation, and it is not one thing, right? And so it requires those pillars, right?
Right. And the five, just I'm not going to get too deep into
Right.
them, but
I'm just gonna name them,
we
yeah.
did do a YouTube video on those. Probably need to update it
Yes.
because it's a little old now. But the five pillars are basically psychoeducation, therapy, group therapy, a support system, and accountability.
Yes.
And there's a difference in group therapy and working with your support group. So, a group that's ran in therapy is kind of its own category, and then a support group really falls under your support system.
Right,
But
right.
as we have talked about before, we are rethinking
There's
some
some
of that.
blending of
Right,
things,
yeah.
I think that's
Mhm.
happened. But
Because
the
of-
idea that you need community, the idea that
Sure.
you need accountability, that you need people, you need your tribe, right? You need to also understand what's going on. Like,
Right.
we started today talking about biology because we're trying to help people understand, like you said, this is not a character defect, this is not a morality problem, right? And so it is important to get educated and then walk into a space with
Yeah.
people that get it.
Yeah.
Right? You're not alone. You're not the only one. I
Right.
promise you that.
How many people have you seen where they read on the psychoeducational piece? They read about dopamine,
Yep.
and they're like, they can come up for a little bit of air.
Yes. Yes, very much so.
But the other thing too is like, that I think they'll see like on Patrick Carnes' book Out of the Shadows, it'll say like on Amazon or wherever, like 1 million, 3 million
Yeah.
copies sold,
Yeah.
and just seeing that
Yeah.
is like, wow, 3 million people have bought this book.
Right.
I'm not alone
Right.
in this,
Right.
which speaks to the community piece and why that's so important. But yeah, those things are really important, and that's what we try to help people facilitate. But the other thing too is that it's so embedded in trauma.
Yes.
Like whatever, I'm not saying that coming and seeing Josh and Carrie or a place like ours is the magic bullet to all that.
Right,
But you got to heal from the trauma, and so whatever method available, and the ones that are most familiar to me are the therapeutic methods.
right.
You got to take a deep dive into your injury, and I'm sorry, you're going to have to get into your past. Like you're just going to have to.
Well, how about we
because-
shift it to you get to?
Yeah.
Because
Yeah.
you
Like,
get
well,
to.
yes.
There's so much relief, really. Honestly, we're saying it, but you and I sit with people every day that actually
Yeah.
they're so relieved,
Right.
right?
I remember the first time a client said to me, it's happened multiple times since, but I don't, and this person was mad, I don't see the point or how it helps
Yep.
diving into my past.
Sure.
And all I could respond in that moment was with, because I can't make guarantees, I'm not saying it will help. But the thing I want you to think about is, should your past have so much power over you that you can't talk about it?
Yeah.
And if it does, like, as you said, like, it should be, I get to talk about my past, not I have to.
Yeah. I get to move through it. I get
Yeah.
to feel differently about it, right?
The freedom that comes
That's
and
right.
knowing you can talk about any aspect of your past, even though it might be uncomfortable to some degree,
Yeah,
you
yeah.
can still do it
Yeah,
and it just not ruin your day
yeah,
is so liberating.
that's right. Well, you and I talk all the time about really what is recovery, and we say all the time it's hope and freedom, right? And
100%. Yeah.
that's reiterating what you're saying. You get to talk about these things that have, you know, been painful, destructive, whatever, and you get to talk about them, and they don't have to do that anymore, right? It may still be
Yeah.
uncomfortable or hard or sad, but it shifts. You're free.
Yeah.
Yeah.
So wild though, like from the brain aspect of it is like, it's just like water and electricity and tissue firing in such a way,
It's
and I
chemicals and
feel
electricity.
this
It's
thing, and
weird.
I don't,
Yeah.
so I don't want to, I don't want to talk about it just basically to avoid a feeling it gives me.
Yeah.
It's all happening in my
I know.
mind.
It is. It's
It's
wild.
not happening now, it's just happening in my mind.
Right. Right.
It is powerful.
It is.
So, anyways, so I did put many links in the description of the video with different types of treatment. Like there's EMDR that's designed to help move the trauma to its proper location in the brain. It's a literal thing that happens, it's not a figurative thing. To get basically to help your body regulate better by letting your limbic system relax. That's the part, that's part of your brain that's going to keep you alive if you're in war, right? So there's IFS,
Internal
which
family
is one of my
systems.
favorites.
Yes.
Internal family systems. It has to do with parts language, and then there's you bring up somatic experiencing a lot,
Just noticing what's happening to your body,
Uh-huh.
right?
brain spotting,
Right. Kind of EMDR
esque, yeah.
esque, right?
Right.
But these are all about, if like Josh said, this is about trauma. We have really now pretty proven effective treatments. It's
Yes.
exciting. These are just a couple,
Yeah.
right?
And
These are the
then,
ones we're most familiar with, but
And I'll
There-
be honest, oh, go ahead. I'm sorry.
and there's more, right? So
Right, yeah.
it's good news.
Yeah, I really am excited to see where we're going with the psychedelic assisted trauma treatment.
Right. We'll see.
Yeah.
Yeah. Yeah.
And so, yeah. Well, we made it through
We
another
did.
episode. I apologize to you at the beginning because I felt like it was safer for me to do
You
that.
didn't think I'd be too mean? No.
Yeah. You're lucky there's a camera on me, Josh.
Yeah, it's true,
I can see
Josh.
you
Oh, you know how
smiling
I am.
through your teeth. But yeah, we have some guests coming up. Can't wait to do that. But we appreciate everybody who's tuned in for the podcast and supported it just by watching it. We hope that the content is useful and that it's gives you some insight maybe and maybe some direction on things. So make sure you check out the show notes. And again, don't forget to just take a second to just give us that 5-star review or to go subscribe to our channel and maybe even hit the thumbs up. So thanks for being here.